Pediatric rheumatologists care for children with arthritis and autoimmune diseases from very early in childhood up until young adulthood, when they're ready to move to adult-centered care.
Because rheumatology conditions are often chronic, patients who are diagnosed with a rheumatic disease like lupus or inflammatory arthritis or others in childhood or adolescence often go on to transition from pediatric to adult rheumatology once they become young adults. And this transition period from pediatric to adult rheumatology can be challenging for many people. For young adults who are transitioning from pediatric to adult rheumatology, they may be used to going to the doctor with their parent or their guardian and not being really the one asking the questions, managing the medications, or making sure that the next steps happen after the visit. So now all of a sudden they need to learn that independence, and that's a gradual process and often a daunting one, but it's also an exciting one that we take a lot of pride in facilitating for our patients.
Transition is the planned movement of adolescents and young adults from child-centered to adult-centered healthcare. And this is really a process that begins in early adolescence. Typically, it's recommended to begin these discussions about transition and to discuss the transition policy even as early as 12 years of age. And then that's followed by planning and preparation for transition through adolescence and into young adulthood. Typical time for transition is usually between 18 and 22 years of age, depending on the patient and their disease course and how comfortable the patient and family are at that moment to make that move. While there are many models of transition, there's no one gold standard. So this may look different for different care teams and different families. And the appropriate time in which to transition a patient may differ considerably from patient to patient, regardless of their chronological age.
For young adults who are making the transition to adult rheumatology care, it's a challenging transition, and it's also a challenging period of their lives in general, where they're gradually becoming more independent, and maybe they're graduating from school and starting their first job, or starting in a new relationship, or all of these things are happening in the background. And at the same time, for patients with pediatric rheumatic diseases, they're managing a chronic medical condition.
What's very important is communication between the pediatric care team and the family, as well as the patient. It's very important to try to help the family and the patient achieve certain milestones in preparation for transition. And those can include things like educating the patient on their own disease, on their medications and doses, helping them understand how to communicate with the medical office, how to request refills, how to request appointments, understanding their pharmacy and their insurance and how those things work. If a patient understands those things, that can help set them up very nicely for transition to adult-centered care.
For adult rheumatologists, when patients are transitioning from pediatric rheumatology care, with a long-standing diagnosis in many cases, we talk to the pediatric rheumatologist at length. We really need to understand the patient's past experiences and their disease trajectory leading up to the point of transition. So we're not starting from scratch as if this is a new patient entirely. We're learning from what's happened before, and then building our own relationship with the patient as they become more independent in their care. At HSS, we're lucky to have an infrastructure around the transition process for patients, and a team-based approach to transitioning patients from pediatric to adult rheumatology. So that team, of course, includes the adult rheumatologist, the pediatric rheumatologist, the patient, their family, but also nursing and social workers and other support staff in the clinic are very committed to making sure that the transition goes as smoothly as possible for the patient.